kind of a huge red flag. And so a good physician that sees if you do have kidney disease and there's a lot of protein in.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of Kidney Coach and Diagnose, and I'm joined again today by the amazing Jessianna Seville, who is the founder and primary practitioner at Kidney Nutritional Institute. I'm going to hand it straight across to you let's get into it. Let's talk all things diagnostic tests when it comes to chronic kidney disease.
So let's talk about getting a diagnosis of kidney disease in the current medical environment. What does that look like? Now, there's actually, 6 areas that a diagnosis can come from. One is the urine, one is the serum, another is the genetics, another is the biopsy. And I feel like I'm missing one more in there. Nope, that's it. Those are the main ones. So I guess there's 4. All of these can play in different ways to a diagnosis. So a couple of common ones. Urine. A lot of times people will get their kidney disease caught, or it'll show up. They didn't know they had kidney disease because they will have done just like a dipstick urine. So they go do a urine sample for the doctor. They take a dipstick of it and they're like, whoa, you have tons of protein in your urine. Now, a dipstick isn't necessarily always diagnostic, meaning that's not the defining factor of kidney disease, but it's kind of a huge red flag. And so a good physician that sees lots of protein on a dipstick urine, they're going to do more workup to see what's going on. One thing that's really important to know about these dipstick urine numbers or levels is that they can change throughout the day, all over the place. So while it's good to catch the I might have kidney disease sort of situations, it is not a good marker to measure the progress of your intervention. Mm-hmm. You don't want to use a dipstick urine to say, hey, I did this dietary change and I'm better or I'm worse, because it's just not accurate at all. Mm-hmm. What you need instead is a 24-hour urine. So the 24-hour urine is a better diagnostic test to know how much protein you really are spilling into your urine on a daily basis. One of the ratios that they will take in there is the urine albumin creatinine ratio. Mm-hmm. That's called the UACR. So what that's going to do is it's going to look at how much albumin, so albumin's kind of a type of protein, and compares it to the amount of creatinine. We'll talk about creatinine in a second, but creatinine's a waste product that usually our kidneys help filter out. And they'll see what the ratio is between the urine and, the albumin and the creatinine. Thus the urine albumin creatinine ratio. It's a really long name. Mm-hmm. Sometimes they have to repeat the test more than once to confirm the results. If you do have kidney disease and there's a lot of protein in your urine from that test, that can change the treatment plan. It can change what blood pressure medication you might be recommended. If you have a autoimmune disease, it can change what steroids they put you on. Like, it can change a lot of decisions pharmaceutically. For us as dietitians, it actually does make a big difference in how we're going to really narrow down and personalize the therapy. So I think it's actually a pretty important one to pay attention to. If it goes down, what you would hope to see over time is that as you add a treatment in, whether it's a dietary treatment or maybe they're using the Diagnose products, or you've started a pharmaceutical drug, you should see that number decline, and that gives you an idea that those treatments are working.
If you want to know more about what we do, head to kidneycoach.com, and we're on all your social media platforms, whatever the social media platform is, /Kidney Coach, you'll generally find us. Make sure you hit subscribe and like, so this helps our little YouTube algorithms, and that means you'll get notified anytime we put up new videos. Jess, thanks again. I really appreciate you, and we'll talk to you all next time. Bye.
Bye-bye.